Welcome back to the Becoming Limitless podcast. I hope your day has been going great. And get this. I have a really interesting statistic for you to hear. So I was looking at like all the episode analytics for the Becoming Limitless podcast, and I noticed 94.1% of the listeners are women. And over the last 90 days, 69.3% are women. And here's what is so interesting to me about this number of 35 plus is 69% of this audience. It means that I am missing a giant topic for my listeners that is going to serve them well. And that is a conversation around perimenopause and menopause. Because as women, we are going to spend a third of our life going through this menopause part of our life, if not more. But yet, not many of us have education on it, what it is, what we go through, what our options are for treatment, both holistic and through, hormone replacement therapy. And so I was like, this is something my audience needs. And I brought an expert onto the podcast to talk to you about this. And her name is Adele Johnston. And she is a certified nutritionist and positive psychology coach who is passionate about helping women improve their menopause health and reclaim who they are without menopause and perimenopause taking over. And she has an online global platform and helps busy women worldwide not only enhance menopausal health and lose the unwanted menopause weight gain, but master your thinking and mindset. And I have to say, since speaking with Adele a couple of weeks ago when we were like, what are we going to talk about on this episode? What are we going to do? What's next? When I was speaking about this topic, I cannot tell you how much more I have learned since then. And in her episode today, she enriches this conversation with so many need to know things that are going to help us arm ourselves to go through this natural transition in life so much more smoothly and effectively, and with that empowerment of knowing what we can do for ourselves, both holistically and not holistically. And so there are so many great nuggets in here, and I cannot wait to introduce you to Adele and jump into this episode on the Becoming Limitless podcast. Adele, welcome to the podcast. This is a topic we haven't covered yet. And I know when I originally reached out to you, I had just found this stat about my audience that it was like 70% were over the age of 35. And I have not talked about perimenopause or menopause or what that experience is. And so I'm so excited to bring you on and your wealth of knowledge to really help us understand how this is going to affect women, not only as business owners, but as moms and as just who we are as we go through this big transition in our life. So welcome to the show, Adele.
Thank you. Honestly, thank you so much for having me. This is a topic that I love to share about and talk about. And hopefully today we're going to have some really good nuggets of information that your listener can take away.
I love it. Okay, well, why don't we start? Tell us a little bit about you. How was your experience going through perimenopause and through this journey? And what made you be like, this is something that I need to coach on?
Yeah, it's a really good question because I get this a lot. How do you know about menopause? Or you're far too young to be in menopause. Well, I was 33 when I started to feel very unwell. And of course, we don't know at that age that that's what it is. It was until I was about 35 when I really knew, because I was already working in the women's health space. I knew my body, I knew that it was hormonal, but it took me a further 2 years of investigations, blood works, biopsies, tests, to get it confirmed, basically. So I was 37 when I had it confirmed that I was, in fact, in early perimenopause. I'm now 40. So it's been a whirlwind journey over the last typically 5 years from 35. And the reason that I then came into the coaching space, I was already working in the coaching space. I actually had 6 clients that I worked with as a bit of a side hustle when I was in my senior corporate role. The work that I did with those ladies was my passion. It really kept me feeling purposeful, alive, really helping them to own their health and their vibrancy journey through positive psychology, through nutrition. I'm a qualified certified nutritionist. And it just became that light that I loved to do. So I was already working in the space. And I then decided that the journey that I had experienced myself both in the medical space, but also just in general population of conversation, I felt really alienated, isolated, alone. I had a lot of shame coming up because I thought, is this something I've done? Or why is my body the one that's failing at that age? What do I do? And all of the literature was really projected. There wasn't a lot 5 years ago, but it was projected at the older woman. And there's me at 37 thinking, but that I don't see me there. That's not me. Yeah, am I really led to believe that this is just the end for me now? Yeah, it's like so depressing to look at the literature that I was like, no, this is not how it's going to be. We are going to change this. And that's what I've done over the last 5 years.
I love that. It's always such a personal story that gets us to where we're going. And
Yeah.
I the more I've been diving into this topic of perimenopause and menopause, the
Mhm.
astound lack of research that is available is insane. Like
Mhm. Yeah.
I it's not a studied thing. And I was listening to something the other day that said even 10% of physicians are up to date on what should be care for women going through perimenopause, menopause. And it's just most
Yeah.
doctors aren't really familiar with hormone replacement therapies, or they're not familiar with new treatments, and they're just stuck in the old belief systems, and we really aren't getting the help that we need. Have you had that as your experience? It's just like a very underserved population, considering half of us approximately are women, and this is like a third of our life. Like this is not like, you're
Yeah.
pregnant for 8 months or 9 months, and then,
Yeah.
but this is extensively larger. It's fascinating.
Absolutely. I love that you've done your research. I love all
Yeah.
that. Yeah.
Yeah. So
Good.
maybe let's start with a bit of terminology here because I mean, I'm 35, and so this was very new to me because you think, and I imagine as you did at 33, you're like, that's so far in the future. I don't need to worry about that now. But like, wouldn't it be helpful to know if you were coming up on it sooner? So let's get some
Yeah.
terminology on the table. Let's talk about what is the difference between perimenopause and
Mhm.
menopause, and how are we able to like know what comes first, what's next? Give us a little background on that.
Yeah. Okay. So maybe if we start that we explain that think of this as like a linear process. It's not, but it's easier for us to think of it this way. So a linear journey that we have as females. And when we talk about females, I'm going to make a statement right now that it's females born female at birth with female reproductive organs.
Mm-hmm.
Okay, just for clarity, and inclusivity.
Yeah.
So when we journey on that linear process, yeah, we think about the four stages that we have as females in our fertile journey. We've got our pre-menopause. This is like our fertile years. We're just starting our monthly bleeds and our menstrual cycle. Yeah, we're journeying. We don't probably not even aware of what menopause is at that age. We're journeying through the process of every month having a bleed, and we're in our fertile window. We then come to a point in our life, and for some women, they can be as young as 12. It happens. Yeah.
Wow. Yeah.
Yeah. And for other women, they can be in their mid 40s.
Mm-hmm.
So there's no age that perimenopause,
Wow.
which is stage number two in that journey, starts to happen. And it's nothing that you have done wrong. Okay,
Mm-hmm.
you've not created a disease or an illness. This is part of a natural journey of fertility. So we're in stage one, which is pre-menopause. We're in our fertile window. Stage two, which is perimenopause. This is when we start to find that the ovaries are just producing a little bit less of the corpus luteum, which is our egg that we release for our monthly bleed, less of estrogen, in particular estradiol, which is part of our estrogens, and for many women, progesterone and for some testosterone. So we just have this slight drop in those hormones, and that's natural.
Mm-hmm.
That window can last anywhere from 2 years up to, for some women, 10 plus years for perimenopause. So there's no age. We can't say that when you hit 45, you're perimenopausal. Yeah. But what we do need to do is have some benchmarks so that we can typically say the average woman will be in her early to mid 40s when perimenopause begins.
Mm-hmm.
I was in my early to mid 30s. So
Yeah.
it does happen a lot earlier. And for some women, like I say, they can be in their teenage years when it happens.
Mm.
So we're journeying into this second phase. Menopause is 1 day. That's it, just 1 day. Okay. And the reason that it's 1 day is we are in perimenopause to the point where our periods stop. So when we have not had a monthly cycle for 12 consecutive months plus 1 day, that 1 day is our menopause day.
That's such a medical definition too, hey? Like,
Yeah, right.
yeah. Yep.
So, yeah. So plus 1 day, that 1 day is menopause. That is phase three. Then we're into phase four, which you've then correctly suggested and said we spend a third of our life. We
Mhm.
spend a third of our life postmenopausal. When the
Wow.
periods have stopped, we've no longer had a bleed for 12 consecutive
Mhm.
months. We are then classed as being in postmenopause. And at that point, we're left with under 1% of our estradiol from when we were in stage one.
So if I'm understanding it right, the big things that are changing during this transition are depleting egg supply, right?
Mhm.
And
Which is
then,
natural and that's
yeah,
normal. Mhm.
and then changes in hormones, which sounds a little bit like a bit of a chaos during perimenopause. Like there's changes and it's not at a specific rate or level. And sometimes you'll
No,
get a period and then not for 3 months, so they'll be close
right.
together. And then
Yeah.
you'll get into menopause. And then this is where you really start seeing that sharp decline, or has it already declined by the point you've
It's
hit?
already declined. So
There
if
you go.
you
Okay.
think about your journey, if we think about the natural cycle within within our fertile years. So when you're having a
Mhm.
monthly cycle and we say, 28 days average, give or take a few days either side is a really nice healthy cycle. And what's happening there, if I use my finger to show you, we've got this beautiful it's beautiful. It's
Like a
like
sine
this,
wave.
yeah, it's like the symphony,
Yeah.
this orchestra of hormones, and they're doing what they should every single month. And we're bleeding and we're journeying through the luteal phase and the follicular phase. And we've got this
Mhm.
beautiful cycle.
Yeah.
But what happens then at the point we start to hit perimenopause is instead of it being this beautiful cycle,
Yeah.
we have a bit of this. And then
Ah,
we
like
go up
erratic
and then
waves in our
Mhm.
hormones.
And we drop think of it like the roller coaster. Yeah, the
Oh,
roller
wait.
coaster goes up and then it drops right down and
Is
then it
that not an
might stay there.
accurate analogy? Hey.
Roller coaster of hormonals and emotions. So
Yeah.
yeah, it's a little bit less, it's sporadic. Like you say,
Mhm.
you may bleed 1 month, you may not the next. So
Yeah.
there are psychological, physiological changes that happen in the body, to the ovaries
Mhm.
during that window, which could be 10 plus years.
Mhm.
And then when we get to the point of our menopause day to post-menopause stage, we've then bottomed out those hormones. There's no more peaks and troughs. There's no cycle. It's just bottom lined out those progesterone and estradiol hormones.
Okay. So it almost is like replicating more of like a male hormone cycle where it's more that consistent. It's not like that monthly cycle anymore. It's more of just a consistent.
It's basically, we're basically left, like I said, with under 1% of what we
Yeah.
had when we
Yeah.
were in our pre-menopause fertile journey, having a
Yeah.
regular menstrual cycle, bleeding each month. And the reason this is important, and this is a different topic of conversation around contraception, but the
Mhm.
reason it's important that we allow the body to cycle like that is because as females, we benefit vastly from estradiol releasing like it does every single month. Our brain has so many receptors for estradiol. Every part of the female body from head to toe has estrogen receptors. And those receptors are what create our health and our
Mhm.
well-being. Yeah. And collagen production. Yeah. All
Yeah.
of the good things that we
Yeah.
associate with vitality,
Yeah.
right through to the health of your bone structure, your
Mhm.
muscles, your heart. We've got so much evidence around this now that we're even finding more and more supportive natures of estrogen for the brain. So if we shut down the body's ability to naturally release estrogen each month, we are going, particularly for years, and
Mhm.
I'm one of those women who started a contraceptive pill at 15 years old.
Same here.
Yeah, right.
I didn't know any better. It was just the only option I was given, and I'm not counseled or on any of the positive or negative effects. It was just here, take this.
That's
I was in
right.
the same boat. Yeah.
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 And me now having two twin girls that are 13 years old, nearly 14, we've had the discussions around, we want to let our body naturally cycle these beautiful hormones because what a gift that we get to feed the body every month with these really powerful hormones. Now, I fully appreciate that there may be listeners thinking, but what about like estrogen positive cancers? And that's a completely different conversation.
Mhm.
Yeah, because again, we need to appreciate that the design of the female body is that estrogen in particular, there's four estrogens,
Mhm.
but estradiol, which is E2 for short, is such a powerful hormone. That's the one estrogen out of all four that we lose
Oh,
in
of
menopause.
course.
Other three, one of them is particularly there for pregnancy, but we hold on to estriol and estrone. And
Mhm.
this is where the estrone really particularly sits within the adipose tissue of the body. So the fat cells
Mhm.
of the body is stimulated a lot through and released as part of the adrenal gland function. So when the ovaries stop producing estradiol, we still have estrogen, yeah, but it's a really weak kind of
Yeah.
effect
It's
that
not
we
the
have.
one that's cardioprotective, bone protective, mental health protective.
No.
Oh
No.
man.
No,
Yeah.
and this is it. It's one of those things where it's okay, so we're kind of losing the queen bee element of that hormone.
Mhm. Yeah, this is so interesting. Okay, so why don't we do this? Let's go back to the very beginning. Like let's say you're speaking to me right now. I'm
Mm,
35. I don't feel like I'm experiencing perimenopause symptoms. I know it's on my horizon. Let's talk about that stage of the journey. What might I be looking for in terms of symptoms, things to watch
yeah.
out for at this stage?
Yeah, amazing. Great question. Because what we can find a lot of the time is we might find that when we are in our 30s, and I think back to me in particular, I had young kids, I had a
Mhm.
house, I had a husband, I still have them, have a husband. I had this, senior stressful career. I'm trying to be the career woman, the mum, the housekeeper, all the things. And we can almost pile up all of these things on top of ourselves that we then think, I'm just feeling stressed. So the itchy skin I'm experiencing, I'm just stressed. I haven't changed, my washing detergent or soap powders, but I'm itching. My hair is thinning. I'm starting to notice that there's more coming out when I'm washing it in the shower. When we take our
Yeah, yeah,
fingers
yeah.
through when we're conditioning it and we
Yep.
start to get more clumps. Nails breaking. We might notice clicking or stiffness to the joints. We
Mhm.
might find that we've got nighttime vision deterioration when we've never had that before. Yeah. So driving at nighttime, you think, I can't really see that road sign as well, or those traffic lights or that warning light has a halo around it, and that's not been there before.
Yep.
Yeah, so nighttime vision compromised. We might find, and a lot of women find this, that they have like ENT, so ear, nose, and throat changes, itching down the throat, stuffiness in the nasal cavities that
Mhm.
feel just like allergy.
Yeah.
Um, Itching in the ears, again, can be another one. And that can be related to histamine sensitivity.
Mhm.
So for someone, one of the things for me was I still really enjoy the odd occasional glass of red wine.
Mhm.
I loved red wine when I was in my early 30s. And I would maybe have, one or two glasses at the weekend. But what I noticed was after I'd had them, I would get extremely itchy. I would
Mhm.
develop a thumping headache and I would develop heart palpitations. And
Mhm.
what I realized was I linked it directly to the red wine. But there's a reason that that happens because red wine is a high histamine alcohol. White wine is not.
Yeah.
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 So it's recognizing changes. So there are, and I can provide your listeners with a list of all of
Yeah.
the symptoms. So I've got a
Yeah.
free symptom tracker that they can click and they'll
Yeah.
be able to check the symptoms against. But if we start from the head, They can be head to toe. Heart palpitations we've talked about. You might
Mhm.
find that you have slight irregularity in mood. Yeah, it doesn't have to be anger, but it could be that you just feel very numb. Yeah, you're not
Mhm.
excited anymore about things, but you're equally not feeling depressed.
Yeah.
Yeah, just very numbed. We hear a lot about things like loss of sex drive and libido. Yeah,
Hmm.
we hear a
Hmm.
lot of things like hear it all the time. I think I've got recurring thrush infection. And
Mm.
actually, it's not thrush, it's reduction in the vaginal tissue health. And that's very common during the early stages of menopause and the latter stages.
Yeah.
So, thinning of the walls, thinning of the tissues can make you itchy.
Yeah.
You might find that you've got smelling or discharge,
Hmm.
painful sexual intercourse or encounters, bleeding when it's unexplained. These are all things that if we work head to toe, there are, 50 to 60 different symptoms that we could
Oh.
align to this.
And they're so subtle too. And you're right. As you were going through that, I'm like, I have that, but not that, but I have that. But it's like it must be so hard for women to be able to walk into a doctor's office because I mean, half of those you would just be like, you have allergies, or half of those somebody would say, and you just
Exactly.
get dismissed. I imagine, especially if you're going through it
Yeah.
early, or you have a doctor that's
Yeah.
just not up to date in their education. They're just like, no, no, no,
Yeah.
you're fine. But I imagine, in addition to those symptoms you listed, at what point do we start experiencing changes in body temperature or periods changing? Because I know for me, something that's happened, and again, like you said, I can't separate it from, I just had two kids. Like I'm just out of that window. My youngest is 2 right now.
Yeah.
And I am off birth control permanently. So I don't know. I'm just learning. I'm 2 years into learning my body again. And I wake up at night like sweaty, but it's only during half the cycle. But do changes like that start to happen where just little things
Yeah.
like that? Because I think like that has to be what this is. Because it's like this wasn't like this before, but there's been so many other changes, right?
Exactly. Yeah, exactly. And when we think about your body in particular, it can take up to the 2-year window postpartum for your hormones and your endocrine system to regulate again. So,
Mhm.
we say about 18 months, but for some women, it can take a bit longer. So when we think about that, we need to allow the body time. Being alert to it is a really positive thing. Fluctuations in your thermostat, so your regulation of temperature, is controlled in the brain. So again, if there are certain things happening at that time, it is very natural that if you're coming off of contraception or birth control for the first time, you may have already had a higher natural thermostat that we just didn't feel connected to previously because of the complications that we can sometimes have, I suppose. But yes, so flushing or flashing,
Hot
night
flashing.
sweat, yeah, flashing. Night sweats are really quite a common symptom.
Yeah.
We find about 75 to 80% of women will experience that. And
And is
again,
that because of the drop in estradiol that's happening? And I'm almost curious if that's what might be
Mm.
happening in the second half of the cycle as you get that natural drop in estrogen as well, or
Yeah, it's
estradiol.
very normal to have fluctuations in your
Fascinating.
body temperature during your menstrual cycle.
Yeah, yeah.
Uh, Yes, it's normal, it's healthy.
Yeah. So when does the cycle changes start? Like either they get further apart, closer together. When does that start, or can it start right at the beginning?
Yeah, it could be at the beginning. That could be your first telltale sign. You might look at when you click on the symptom tracker, you might look at what's on there and think, I have none of that, but I am noticing that my menstrual cycle duration is longer. Yeah,
Mm.
I've actually gone for a month and a half or a
Mhm.
month and 4 days and not had a bleed.
Mhm.
And then you might have two in a month. Yeah, so it's all of a sudden your regularity has changed, your flow. So where you maybe always had a very light to medium flow, you might transfer into medium to heavy flow.
Mhm.
Yeah.
Yeah.
Pain. So a lot of women will report that they've maybe had really quite easy to manage monthly cycles and bleeds to heaviness and a lot of severe cramping and pain. So
Mhm.
these can be indications, anything that we would deem to be change for you, yeah, is
Yeah.
what we would say is okay, that's an indication of some change. We track it,
Yeah.
we monitor it, and we see if it's becoming more sporadic. Is
Yeah.
there more things starting to occur?
Okay, so we have all these changes that are happening through perimenopause. How do the symptoms change once you reach that day of menopause and then into postmenopause?
Yeah. So I think that there's this misconception that we kind of have this horrific ride through perimenopause and then it's over. And we hear a lot of women say, I'm out the other side. Like, I'm fine. I'm through it. I've done it. I've worn the t-shirt. I'm out the other side. The kind of complexity of this is that when we enter into postmenopause, that's where the greater risk profile sits. So we are 50% more at risk of cardiovascular related disease and or stroke
And that's
when
because
we
of
are
the
in.
estradiol dropping right out.
Correct.
Gotcha.
Correct. So because estradiol is so heart protective, and we know that through the limited amount of research that we do have, we understand that. Once we then enter into post-menopause, so that fourth stage where we've bottomed out those hormones, we are 50% at more risk of cardiovascular related disease and or stroke. We are 1 in 2 to 3 women, normally 1 to 2, will develop osteoporosis. So the brittling of our bones, again, because estradiol is so bone protective, yeah, when we start to lose that, this is why things like resistance training and weight bearing exercise is so, so important at any age, but in particular, the work that you are doing now for your 35-year-old self is helping your 45-year-old self.
Mhm.
The work I'm doing at 40 is helping my 50-year-old self get out of the chair unassisted
Yeah.
and, be able to live life with my mobility. So we have to be thinking about this as the more that we can support the body with the knowledge that we have from this, yeah,
Mhm.
resistance and weight bearing activity is essential for health.
Yeah. So I'm hearing, okay, once we cross into menopause, postmenopause, the risk of
Mm.
cardiovascular disease goes up, bone
Mhm.
brittleness, which I mean, I
Mhm.
imagine down the road can lead to hip fractures,
Yeah, which
pneumonia,
can be
like,
fatal. Yeah,
right?
absolutely.
How does maybe mental health change through this journey or our experience of yeah, just feeling ourselves? Because I feel like
Mm.
that's something that
Yeah.
nobody is addressing. Well, I mean, there are now, but like in terms of going to your doctors, it's like going straight on to the antidepressant without recognizing. Maybe you could speak to
Yeah.
some of the mental health changes through this journey.
Absolutely, yeah. So when we think about mental well-being,
Mhm.
yeah, it's like that connection to self, and that can come in the form of when we start to see the physical changes that menopause can bring to our body, it can become very upsetting for a lot of women. So we might find that we've got unwanted fat gain, and we are trying so hard to lose it and not able to. Yeah, and there's reasons that that can happen. We might find that we are changing in many different ways. Menopause can impact the structure of the facial features and the bone, because again, the jaw is a bone. And as
Mhm.
we start to age, naturally, we lose a bit of our plumpness, our collagen, and our bones can change. So we might find that we've got teeth movement.
Mhm.
Yeah, well, we've not had that before. And we think, oh, my teeth are getting squint or gums receding. Yeah, and there's so much that can happen. So the whole thing with mental health is that it can be created and caused by a lot of the symptoms, and that we just feel very removed from who we are, just jointed from who we are.
Yeah.
But we can also have those impacts of when we have these declining three main hormones. So estradiol, which is part of our estrogen, progesterone, yeah, which we need to maintain a really healthy womb and uterine lining, and testosterone, which is our third female hormone. Yeah, those are all three. And when those three start to drop, testosterone is such a powerful confidence and motivating hormone for us that there's stages within your menstrual cycle that you will just be like, "Oh, I feel invincible today. Like I could literally take on the world and be like, bring me more." That is testosterone. We're having a beautiful surge of that hormone that helps us feel really invincible. I
Mhm.
call it our badass hormone.
Yeah. Yeah. That's usually like what, about day 10 to 15 of the cycle,
Exactly.
somewhere in there.
Yeah,
Yeah.
exactly. So,
Yeah.
we as business owners and entrepreneurs, this is when we're saying, and I do a training on this, so maybe that's something that we can talk about as well. But I do a training around harnessing your hormones for business success. And when we can really understand our cycle and how our hormones help us feel, I could be telling you that testosterone surges make you feel invincible, but you might have turned around and said to me, actually, I don't. I just get really tired and need to hibernate during that time. So, what we
Mm.
want to do is understand, well, how do we feel? And at what point in our cycle are we having these hormones surge and drop? Because if I said to you, we're going to jump on and we're going to do this amazing TED talk together. Okay, we're going to be in front of hundreds of thousands of people online, but actually you're not in your cycle surge of testosterone. Yeah, you're getting ready to go into ovulation and bleed. And in which case you're like, oh God, no. I just want to hide. I want to put on my hoodie. I want to put on my fluffy socks and have a blanket. I'll see you next week.
Yeah. Yeah, that week
So,
on my calendar has a giant banner that says book nothing extra on that week.
yeah,
And I
right.
don't.
You
I
don't
keep
want
it very light. That's next week for me. There's nothing extra.
Beautiful. And I love that you know that. And those are
Yeah.
like your admin days. Those are your behind the
Yes.
scenes working days. Those are your team meeting days. They're not your customer facing or your sales calls. There's none of the like high vibe energy stuff during that week. But
Hmm.
when you know when that week is going to be, you can then book the TED Talk. You can book the big speaking events because you know you're going to have this like, I am so ready for this energy. So there's lots that can come through the mental health journey that you have not created. Yeah, if you start to think, "Oh, I've just got no motivation, you're
Yeah.
not lazy.
Yeah,
If you
no.
start to think, I just can't go and start this project because I don't know how, but it's never been an issue for you before, that can start to generate a lot of shame because I should be more busy. I should be creating more projects or programs. So there's a lot that can then come from that we start to almost internally shame ourselves.
Yeah. Maybe
Mm.
you could speak a little bit to the changes in anxiety and depression that may or may not happen through this journey of peri into menopause, postmenopause.
Yeah, absolutely. So this, again, a personal story that can bring this to life as well. So with the whole depression and anxiety or anxiety with depression, we can experience a kind of vast, quick change sometimes. And for me, I had never really experienced what that felt like until I was in the thick of my early perimenopause journey. And the anxiety was so crippling that my marriage started to fail. My relationship with my children was just difficult. And I started to push a lot of people away because I just couldn't show up. I didn't know what I felt. I didn't know how to put words to it all, but I knew I wasn't depressed.
Mhm.
And, we hear this a lot from a lot of women where they say, I know I'm not depressed, but the doctor keeps telling me I am. And actually, it's an imbalance in these chemicals in the brain. So, when we think about anxiety and depression, your medical provider, whether that be your GP, your doctor, maybe even sometimes your gynae, your physician, they may suggest antidepressants because that's all they know to be able to support and guide you. But the amount of knowledge and understanding and evidence we have, whereby bringing in some holistic and complementary therapies to that can be so profound within your care.
Yeah.
Ultimately, we need to find a solution for this for you. For some women, the right thing is hormone therapy, and we replace the missing estrogen.
Mhm.
For other women, it's not for what is right for them. And we look at things like breath work and breathing techniques. We look at calming the nervous system. Yeah, and that can be through outside fresh air walks to
Mhm.
stimulate serotonin in the gut. So there's lots that we can do when we understand how you feel.
Yeah. Okay, so
Mm.
that's a good segue. Let's go into like what we can do to help ourselves through this.
Mhm.
And I imagine it will look different at different phases. But like if we start at the beginning of this journey, what are
Yeah.
let's talk first holistic practices all the way through, and then we'll go on to different hormone options after that.
Yeah. Okay. So holistically, we've touched on a couple there. So breath work. I am advanced trauma informed within my breath work, and I'm currently studying my master's in psychology at university. I've got 6 more months and then
Good for
will
you.
be
Almost done.
clinical psychologist. Yeah. And the reason that I'm studying all of that is because I recognized very early on that menopause starts in the brain, not the ovaries. So we're told that it's when the ovaries are starting to, for want of a better phrase, fail. The ovaries are coming to the end of the fertile journey. It is natural. However, in order for the ovaries to do what they're doing, the brain must signal to the ovaries to do that. So it starts in the brain. And I wanted to understand more about cognition and the human brain and how these hormones and chemicals and everything changes and affects us. So when we think about holistic or complementary based therapies, we've got everything from things like acupuncture.
I've heard
Yeah.
that that's been effective.
Yeah,
Yeah. Well,
yeah, it can
how does
be.
that work? Do you
Can
know
be.
the mechanism behind acupuncture's effectiveness?
So we don't have any like clinical
Concrete.
studies
Yeah,
on
of course
this.
not.
Yeah, yeah, absolutely not. We would be years down the line of doing it to understand it, but we do understand that there is a certain relaxation that
Hmm.
comes from these practices. It's like having a massage to physical touch on the body. If your love language is physical touch, then having a massage is like recharging for you. So if we can lower the vibrations within the brain and the body, and the brain feels safe and the brain feels calm, we can stimulate a lot through the nervous system, the vagus nerve, the gut, and we've got this more optimal, like homeostasis state of
Like
mind.
rest and digest, right? Calm.
Absolutely, yeah.
Yeah.
Yeah. Because if we're not there, we're in fight, flight, or freeze.
Yeah.
And when the brain is in this SOS state of mind, where it's, if you visualize, and I'm a visual person, if you visualize kind of these claw grabbers, that's not what your estrogen receptors look like, but let's just give it a face. If we visualize grabbers in the brain and they're trying to eat up the estrogen and get fed with that, but there's nothing there, it creates almost this stress response in the body. Yeah, so we go from feeling quite optimal and homeostasis, equilibrium state of physical mind and body to feeling very disjointed, very fractured.
Mhm.
And we don't understand why because nothing has changed in my
Yeah.
life. Yeah.
Yeah.
So bringing things like acupuncture can be very restful, massage.
So what I'm
We've
hearing
talked about.
is relaxation, fight or flight, lower cortisol, lower adrenaline, and doing things to support that, right?
Yeah, absolutely. Because when
Yeah.
we think about, the word stress, we've got the feeling of stress, but we also have the physical stress, the oxidative cellular level stress. And what that's doing around the body is the brain is literally saying, and it's a beautiful function of this brain, but it hasn't evolved to where we are now in this year. We're in 2024. The brain that we have is the brain that we've had for millions of years. And its still primary function is to risk assess, yeah,
Mhm.
and keep us alive. So find the risk and avoid the risk. So what it does over the course of the depreciating hormones is put us into that. It's constantly scanning for risk.
Mm.
So it's in a chronic stress response state. So if we can actually then say, whoa, wait a minute, we're fine. We are safe. We are fine. Yeah. And that
Mm.
can be through things like tapping. So if we've heard of things like
EFT.
EFT, tapping can really help us to take back some control where we can bring in some affirmation statements. Yeah. So I am absolutely safe and well.
Mhm. And
We
just if you were watching the podcast, where were you tapping, Adele, when you were saying your
Oh,
two
sorry.
fingers?
So 2 fingers, I am. So just in between the third eye for those that do their manifestations and meditation work. So between the two eyebrows. Yeah. So I am between the eyebrows. On the top of the lip, just in the the
Little
part
scoopy
between,
part.
yeah, I'm trying to think of the real name for it, and I can't think of it now. The part between the two nostrils and the top of the lip. So your Cupid's bow. Yeah, and you're just kind of tapping in there. So I am top eye, third eye, feel very safe
Mhm.
and well, and just on the chin. So it's in a
Mhm.
straight line. Yeah. There's
Yeah.
other areas that we can tap as well. So we can use the area just below the collarbone. If you can see on me because I'm quite lean up top. But just in here, there's a little dip. You can just take the two fingers and just gently massage in
Mm.
there. And that's a really calming one to do if you
Do that.
find yourself feeling very overwhelmed. Yeah, you can just sit and rub in there. Another one that's really powerful is breath work. And we
Mm.
can never underestimate the power of the breath because I'm going to demonstrate a breath right now, and you'll hear it on the podcast. But this is how we should breathe. So in, now I'm breathing in through my mouth so you can hear it on the podcast, but that's in through the nose.
Okay.
Yeah. And out through the mouth. The out breath is longer,
Mm.
but we breathe like this
More of a one-to-one ratio.
throughout the day,
Yeah.
right? Because we're talking, we're moving. But when we can take a mindful moment, and it can even just be 3 purposeful breaths, you can do that in your office, you can do that in your car, on the toilet, you can do it anywhere, right? It doesn't have to be a carved time. But if you take a deep breath in through the nose, yeah, and fill your lungs, and then release that breath through the mouth. When I was doing my training, this was years ago, we were trained that there's multiple different breaths that we can do. It's super powerful. But we were trained that if you can do a 20-minute mindful breath work practice, yeah, it's the equivalent of having around a 2 to 3 hour sleep for the brain.
Wow. Wow.
Yes. Restful, recharging, calming.
Yeah.
And, I really call upon anyone that will practice a 20-minute breath work and not come out of it feeling amazing.
Right? Yeah.
Mhm.
And especially like I know going through these changes, sleep is something that gets impact heavily.
Yeah.
Just because, waking up at night, overheating at night, all of the things. So,
Yeah.
I mean, if we're able to use this breath work as a tool to help restore some of that interruption, I
Yeah.
imagine that could be quite powerful.
Massively, yeah. And again, sleep disturbances don't happen to everyone all of the time, and they happen to many women all of the time, which again can impact on our mental well-being and our mental state of mind and clarity. We become very irrational when we're not slept. As
Mhm.
human beings, we need sleep and we need water.
Mhm.
Yeah, we don't particularly need food. We can live for a long time without food, but we need water and we need sleep.
Mhm.
So it's about this whole state of well-being and mental clarity. So again, it's that point of if you can do one thing for yourself, it's completely free. You can breathe. Yeah, and
Mm.
learning that breath. We teach a lot of chest and belly breathing. Yeah, chest breathing can be very activating. So if you are in a bit of an anxious moment and your heart is really beating, you feel like you're having a palpitation or a flutter, then chest breathing might not be right for you. So doing belly breathing. And a belly breath is where we don't move the chest. So when you breathe in, you push the belly out. Yeah, really push it out as far as it will go. So you breathe
Yeah.
in, belly goes out. And then when you release the breath through the mouth, you pull the belly back into the spine.
Mhm.
Yeah. And it's such a calming breath to really help to regulate where you are because you have to really think when you breathe in, you push the belly out. It's not a natural thing for that to happen.
Yeah, I remember being retaught. It was pelvic floor physio after the first baby. She's like,
Yeah.
you're breathing funny." He's having to relearn that. But it's amazing how much, especially if we are prone to anxiety, that we start
Mhm.
shallow chest breathing. And like
Mhm.
you end up over breathing. right? I think
Correct.
which also
Yeah.
contributes to further anxiety. So, okay, so we've got the breath work, those holistic practices. Maybe we can touch briefly on what can we do with exercise and what can we do with nutrition to help us smooth this
Mhm.
transition the best we can.
Beautiful. So exercise, we've already touched upon, it's vital that we do consider resistance training slash weight bearing activities. So I don't mean that you need to go and join a bodybuilding gym. I mean that you can do these things yourself. So think outside the box. If you don't have something like a weighted vest that you can wear on a walk, then how can you add more weight to the body so you can resistance train on a walk? Yeah, that's the same thing. If you do have access to weights, then adding some weights to what you do is beautifully powerful for all things in your body and your mental well-being, your cardiovascular health, your bones, your muscles. So weight bearing or resistance training, and aiming to do that 2 to 3 times a week for around about 30 to 40 minutes. No less than 30, 40 minutes is maximum. You don't need to go any longer than that. Um, Cardiovascular, beautiful. We've got some nice emerging evidence that can show that that can be really effective and helpful for the temperature that we talked about with the flushing and the night sweats. So again, it can help the heart to regulate your temperature through brain connection. So cardiovascular, that can be anything from a really brisk walk. We call it steps for health in our company and what we do with our ladies. Daily steps for health is a non-negotiable. And what we say to our ladies is, rather than thinking about certain levels of VO2 max or heart rate monitoring, just go out, walk to a brisk pace, and aim to get sweaty boobs. Okay?
I know exactly what you're
Yeah.
talking about.
Right? Aim to get sweaty boobs. So you're like, okay, yes, my heart rate's up because my boobs are sweaty.
Yeah, that's
A
so
good
good.
one.
Okay, anything on anything you'd add to that, or then anything on nutrition? I just want to make sure we get onto hormone
Yeah, of
replacement
course.
therapy too.
So another thing to consider just with the movement is stretching. It doesn't
Oh,
have to be yoga. A lot of women resist the word yoga, but stretching of some kind because it will really help your mobility and the suppleness when you are training. So those were three things for lifestyle and movement. For nutrition, it's a bit underwhelming when we think about we don't actually have to be making really ridiculous changes in menopause. But what we have to be aware of here is we cannot, as women, eat low fat food intake. Okay, so we want really good volumes of healthy fats. And we average this between 35 to 40% of total daily calorie intake being healthy fats. So things like your olives, olive oil, oily fish, nuts and seeds. These are
avocados.
all avocados. Yeah, it's a
Yeah.
high histamine food. So if you're histamine
Oh.
sensitive, then bearing in mind that one might trigger some itching or
Mhm.
the ear, nose, and throat symptoms we talked about.
Mhm.
So yes, thinking about what are you bringing into your day-to-day diet that is in the healthy fat category. Yeah, if you're having something like a Greek yogurt with berries, a little drizzle of honey, then chuck some nuts or seeds on there. That's going to give you your, portion of healthy fats in that meal. We want to make sure that protein is also part of that.
Mhm.
Okay, so realistically, we want about 20 grams of protein at each main meal in the day. Try to get around 90 grams
Mhm.
into your day. The
Mhm.
reason for that is that we are one big protein and our body needs the amino acids. Here we have those essentials to repair, to thrive, to grow. So when we think about what the bone needs, the bone doesn't just need calcium, the bone also needs protein. The
Mhm.
muscle needs protein. So we want to go higher fats. We want to look for healthy fats, good sources of protein. And then carbohydrates, they're not the devil.
Mhm.
Okay, the holistic approach to food. There's actually an amazing documentary right now out on Netflix, and it's all about the blue zones of the world. There are five, and the blue zones are where we have the most population still living that are 100 plus years. And these individuals are phenomenal. Okay, but they don't cut food groups. but they're
Mm.
very active. So anybody that's interested in that type of thing, go watch it. It's phenomenal. And it just shows us that there's not one way of eating or living, but there is a sea that runs through this
Mhm, mhm.
that each of these people do. And it's socializing with loved ones. It's eating to like a eat to about 80% fullness and then break to check in with the body. So there's principles of intuitive eating in there. Really powerful.
Oh, I love that. Such a good resource to take a look at. So we're really looking at making sure there's healthy fats in there, carbohydrates that are coming from a whole food source, I imagine, potatoes, rice, quinoa, as opposed to like pizza, cake, and stuff like that. And then
But again,
protein.
these foods are not off limits, right? I
Yeah.
think this is where we can fall trapped
Mm.
into this demonizing of certain foods and individuals feeling like they must only shop organic range produce. But actually, we have to just be aware that having pizza will not,
Mhm.
kill your body. Yeah. There's individuals out there that will think that's true. But what we have to do, and I'm calling at this from a nutritional point of view, we want to make sure that we're bringing the majority of our foods from, the source. So the earth, plant-based options, roots, fruits, and vegetables, and then bringing in some complete protein source options. If you're vegan and you're listening to this, you will not be getting complete protein source options easily. You can get them by really curating your food groups. But please make sure that you're then supplementing with a vitamin B12 because you won't be getting that there. That vitamin
Yeah.
is only through animal produce.
Yeah. Awesome. That's great advice. Okay, so let's touch on hormone replacement therapy. As I know we've got all our holistic options, but what is it? How do we know if we're a good candidate for it? What is your general recommendation? I know this is usually something that you'll probably have to be in collaboration with a physician about.
Yeah.
Um,
Yeah.
but what does that look like as an option?
Mm. Okay, so hormone replacement therapy, or HRT for short, we're also hearing some people calling it menopause hormone therapy, or
Mm.
MHT.
Mm.
So regardless, if we think about this, it's a transdermal or oral. We much prefer to go transdermal so that it's through the top of the skin rather than ingesting it through the system of the body. And it's a top up basically of the hormones that you're losing. So estradiol, progesterone, testosterone. If we take estradiol, that can come in the form of a gel, a patch, or oral.
Mhm.
Yeah. And you would need to link in with your gynae or physician or GP to discuss what's right for you. And there's multiple different options that we can look at through estradiol. Okay, so that's kind of covering that one. Progesterone, we don't have as many options. I currently replace my estradiol through a gel, and I have my progesterone through the Mirena coil.
Mhm.
So it also acts as my contraception at the moment.
Mhm.
Um, we can also have an oral form and a vaginal pessary for that as well. And then we have testosterone. And based in the UK, we don't tend to go for things like the implant, the pessary, or the injection for any of these hormones. We look at it through gels, patches, and then obviously the Mirena coil, the IUD or IUS, however you want to pronounce it.
Yes.
So there are options, but it's speaking with either your menopause support, might be a doctor, might be a pharmacist. They will be able to advise you on what is available to you in the country or region that you're in.
Yeah, this is awesome. Okay, so I know when we first spoke, I had said to you, like, I am a very
Mm.
crunchy, all natural, like the idea
Yeah.
of hormones. Like, my history is like I was on an estrogen-based birth control and I got two blood clots. So,
Mm.
naturally now I'm very cautious of what I put into my body. And I asked you this
Mm.
question. I said, how do you make peace in your brain? And I'll tell you that my position since talking to you last has changed after I've learned so much. But what are some of the things that are like, okay, if we're coming from, you're talking to a community here who's very like, even Advil and Tylenol are things like I'd rather
Mm.
not. How do you have that conversation with someone who feels that way, much like I did when we first talked?
Yeah, it's understandable. So,
Mhm.
your feelings are validated. And because we don't have as much information widely available to us through being able to go to the GP or the doctors and say, look, I've got concerns and have them talk it through with us because they're not really trained or educated, that becomes a bottleneck and a challenge in itself. So, of course, we start to think about things like, well, I just don't want to put hormones in my body then because I don't know what they're doing. Disclaimer, I replace all three of those hormones, and I do so through the knowledge I have. There is and there will always be risk with anything and everything that we do. Where I look at it is I am coming from a family where Alzheimer's and dementia is there. So my mum's mum passed from that. So I know my risk is greater of potentially developing it. So if I can give my brain longer with estradiol, because I didn't from when I was 15, can I? And I don't know the answer to this because there's not a research on it. We've got some happening in America just now through Dr. Lisa Mosconi and her team. But we don't have enough to say, yes, by doing that, you are protecting your brain. I do know, however, because we've got heart disease in the family, that I'm at greater risk of that. 50% more likely to have risk of it when I'm postmenopausal. So I opt to replace that hormone to a low level so that
Mhm.
I'm not going back up to where I was in my teens, yeah, but I'm bringing it to a base level that I know it's protective of those organs.
Mhm.
So I think what we need to do is just be aware of, but what is it? Now, these these hormones are derived from yam plants. Okay, but they're not just yam plants mushed up and then put into a bottle. They are obviously then transferred and go through a process through pharmaceutical. So we batch test them. We check that the application of them dispenses and its efficacy is there so that we know that it's dispensing what it needs to dispense in a method that's deemed to be safe. So transdermal route is where we deem it to be safer because it's not entering through your digestive system. Yeah, you're not orally ingesting it. You're popping it on through the blood barrier through the skin.
Mhm.
So we've just got to ask ourselves, what do I want? Are my symptoms life altering? And for 25% of women, the symptoms are so life altering that life doesn't even want to go on living anymore. Yeah.
Mhm.
And if you're listening to this and that is where you are, then I send you so much love because it's so tough when you're in that space. I work
Mhm.
with many women in that space. So we ask ourselves, do I want to just continue like that, or do I want to help myself now?
Mhm.
Yeah, and continue to ask, is this still what I want and still right?
Yeah.
So I can't sit here and say that it's risk-free. There are risks with everything. But as long as you are under the care of someone who knows, can answer your questions and guide you. And one thing that I always say to my clients is it's so important that you do your own research. Okay, this is your body, it is your decision, and you have full autonomy to make that decision based on your own knowledge. It is
Yeah.
not up to your physician or your GP to know more about your body than you do.
Yeah. And I think one of the things that you said to me last time when we spoke, that cracked the door open in my mind because I'm always
Mm.
open to being wrong. I think that's one of the most important things is
Yeah,
like I
me
have my
too.
beliefs and I'm firm in them until I am proven wrong. And then I'm
Mm,
willing to reconsider. And I love that. And one of the things you said to me was, yeah, you know what? There are risks with this.
mhm.
However, I know that there is a very small increased risk of hormone related cancer, specifically breast cancers. I know that there are risk factors with cardiovascular. I know these things. However, I then contrast that with my life. I am
Mhm,
healthy. I am a
mhm.
healthy weight. I eat well. I exercise well. I sleep well. And so many of the things that you were telling me that you do create a favorable condition for health, that the cardio effect, protective effects, the bone health protective effects, the mental health protective effects, those
Yeah.
things outweigh that minor take on and risk because of the health that you have gotten yourself in coming into this journey. And that for me, I was like, doors cracked open. And then as I told you before we jumped on, like I went down the
Yeah.
rabbit hole in the last month since we've talked and
I
learned
love
so.
that though, right?
If
Because
you hadn't have cracked that door
yeah.
open for me, I don't know that I would have changed
Mm.
that stance, which is
Amazing.
interesting. Yeah.
Yeah. But here's living in your power source of empowerment to take your own action from what you know at this time. And as the evidence continues to evolve and we tend to get more and more coming out from it, the more exciting this gets to be and the more evolved our options of hormone replacement get to be. We are not living in the world where the WHI, so the Women's Health Institute, had this, it was a worldwide fiasco, if you remember back. I don't know if you will, you're quite young for this, but there was a whole big hoo-ha about a study that was conducted around hormone replacement therapy. And what had happened was the information was not factually correct. It got out into the media that hormone replacement therapy equaled breast cancer.
It was like
And
before the results were even like shown or something like that. They just went straight to
exactly.
the, yeah, I did hear
Yeah.
about that. Yeah.
So, I mean, that's the study in itself with that was actually a really good study. But what had happened was, and I won't really get into this, but their participants were not, they were all postmenopausal women. They had additional risk factors and disease and illness already. And there was so much going on in there that the study design itself was slightly flawed. The study concept was actually pretty good, but the whole aftermath of that was just a mess. And so many women stopped their HRT, which was of my mum's generation. My mum's in her mid 60s now. And we've seen different rise and falls of different disease and risk factors. However, that study has now been re-reviewed and completely washed around the outputs that came from it. The HRT that they used at that time, we do not use that HRT anymore.
Mm. Yeah, and I remember you saying to me too that the research that's now coming out of Europe is so far ahead of, I'm in Canada, but in the States too,
Yeah.
it's like you guys are so far ahead of us. Unfortunately, we're not quite keeping up over here, but there's so much
But
more
yet
that's
we're
coming
so
out.
far behind in the UK as well. When we think about
Yeah.
where the UK is with menopause care, we are ahead of where kind of US, Canada, quite a lot of different places. But we
Mhm.
have got amazing people like the neuroscientist Dr. Lisa Mosconi, who is in America doing a lot of this research on the brain. And that's feeding into then the UK counterparts that are researching more into the endocrine. And it's just phenomenal to see what's coming out of it.
Mhm.
But until we have more budgets, until we have more research and controlled trials, randomized and really controlled, we don't know yet. And I think that where I come at this from, like you've quite rightly said, I will do what I can to give my body the best foundations, my
Mhm.
health the best foundations. So it's not that I don't eat pizza, donuts, and drink wine. I
Mhm.
just limit that.
Yeah.
It's that I don't sit sedentary every day. I move, I
Mhm.
stretch, I
Mhm.
weight train. Yeah, I do mindfulness practices like breath works and journaling and daily gratitudes because the evidence shows us that those practices stimulate this beautiful cocktail of emotional chemical release.
Yeah.
So, and these things are free. So if you can do just one thing for yourself every day, it would be to start your day with a daily gratitude.
Mm. I love that. So actionable too. I love this. This has been
Yeah.
fantastic, Adele. Like, I honestly feel like given the opportunity, we could probably still find so much more to talk about on this. Why don't we first, do you have links that you can direct us to for the two resources you talked about? You said one, there was a symptom tracker, and the second, there was training around harnessing hormones for business success. Those are the two that you
Yeah.
mentioned.
So the symptom tracker, I'm just writing this down so I don't forget, perimenopause brain and all. Symptom
Mhm.
tracker, I will send you a link over to.
Okay, and I'll
The
make sure that's in the description if
Yeah,
you're looking for
absolutely.
that. Yeah.
And I think what's really interesting with this is it really helps you to see very clearly what the typical symptoms are.
Mm.
If you head over onto my Instagram, there are so many free resources there. So you'll find me the dot menopause coach. Or if you head into Google, you can put Adele, the menopause coach, and everything that I am active on platform-wise will come up. I also have my own podcast, The Menopause Coach. And that podcast, I mean, there's like 111 episodes now, so you can go for glory. Every single week we release an episode there, which is around 30 minutes long. And some of them are with guest experts and others are me teaching. So it's always about a topic that is relevant. So yeah, use these as resources, empower yourself with knowledge, because when you have the knowledge, it's phenomenal what happens when you walk into your practitioner or GP appointment and you're able to say, well, actually, that's not correct. This is what I would like to do.
That's one of my favorite pastimes, Adele. That's why my doctor and I don't get along very well.
Empowered action.
Right? Oh, so good. Okay, so I'll make sure the link to the symptom tracker, the hormone for business success training, Adele's Instagram, and the Menopause Coach podcast. Those are all going to be in the description. Adele, thank you so much for your time. This has been such a value add to this podcast and to my community. I appreciate you taking time to come speak with us.
You are super welcome. Thank you so much for having me. And any questions, I am open to answering them.
Yeah. All right, you guys have a beautiful week and I'll talk to you next time. Bye. Want to know more about the Becoming Limitless program? Everything you need to know is linked in the description. You can head to my website at tanessashears.com to learn all about the program. Or if you're not ready to work together yet, you can check out my free podcast, Becoming Limitless. It's the go-to podcast for entrepreneurs who want to optimize their brain and their body with biohacking.